If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Number one thing, don't take advice from some asshole on the radio.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and it's now exclusively a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott. Oh, your mic's not on. What's going on? I'll try that again.
Hey, Dr. Steve. Hey, Dr. Oh, there's the reverb. I like it.
Oh, goodness.
Hey, Dr.
Well, this
Steve.
is so much better than the other show.
Yes.
And ladies and gentlemen, Lady Diagnosis back from sabbatical. Hello, Lady Diagnosis.
Hello, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347. But follow us on Twitter at Weird. I was thinking for a second, God, did I need to change that too? No, we're good. Follow us on Twitter at Weird Medicine or at DrScottWM and at Lady Diagnosis, right?
Yes.
You still on there? Do you ever check it? Never.
I will.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. One thing I want you all to do is go to stuff.drsteve.com and scroll down, and you can find our card game called Wet Brain. It's a Dabbleverse related card game. It's based on the game Presidents and Assholes. It's a party game. It's fun. It cost me a lot to make it, so unfortunately it's like on there for $30, but I'll autograph the back in gold and all that stuff. If you want it, go to stuff.drsteve.com. And we use Shopify, so it'll let me know if I start running low on stock, and I'll get it out there ASAP. It's usually less than 24-hour turnaround, but stuff.drsteve.com. And also you can scroll down and see the Rode robotic tuner, which we use in the studio to tune our instruments. Sometimes you wouldn't notice that we tuned them, but it is a robotic tuner, and they also have a thing called the Rode Coach that'll teach you how to play an instrument. Lady Diagnosis, do you know how to play an instrument?
The piano.
So I've had 3 different people in here. One was DNP Carissa, who moved away, and then NP Mel B, who has Raynaud's and couldn't really play, it was difficult for her to play the instrument. Of course, you have a condition that might prevent you from playing, but if I give you a Rode Coach and a guitar, will you put the time in to let it teach you how to play and then come back so we can demonstrate that the stupid thing actually works?
I would be willing.
Okay.
I don't make promises on if it's going to work or not.
Well, no. You
But
don't
yes,
have
I
to
will
promise
give it
you
a
will
shot.
succeed. Will you give it a shot? Okay.
Yes.
And we'll talk in a minute why this may not work for you either, because everybody in here apparently has got some goddamn malady that prevents them from playing an instrument. But anyway, and then
some of us, it's just called the lack of talent.
Right.
Which is different, of course.
Correct. That's yours and my problem. But and then Patreon. Check us out on Patreon, patreon.com/weirdmedicine. I've got some exclusive content in there. There's classic shows you cannot get anywhere else because we did things when we first started that we really, would just as soon not be out there. And all the video things that we are doing will now be there first. So check that out at patreon.com/weirdmedicine. Also, if you go to youtube.com/@weirdmedicine and join or click the button that says accept gifted membership. Sometimes Myrtle goes in there and gives out 20 gifted memberships. A lot of this stuff will go there first, too. So check that out. And if you want me to say fluid to your mama, check out cameo.com/weirdmedicine. I did several of them for Ahmed, our medical student from Saudi Arabia who got turned on to medicine by listening to our show. I still can't believe this.
It was hilarious.
In Saudi Arabia now is living in, he's graduating here in, let me see, 22 days from residency, and he's going to be faculty at a prestigious academic institution in the United States. So it's pretty cool. Yeah.
That is so exciting.
Yeah, very proud of him. So
cool.
Mumtaz Siddiqui, and I can't remember how to say congratulations, but I say Barakallahu Fik. It just means God bless you in Arabic. So anyway, Ahmed is an awesome dude. I went up, he had me come up to do grand rounds up there, and I got to meet some of his friends, and one of his friends is a ham radio operator, and I sent him a little what we call QRP transceiver. It's a digital transceiver that you can just throw up an antenna, and anyway, who cares? Anyway, but he's a cool guy too. So hello, Dr. Adkins. I don't want to dox anybody. But anyway, they had me do a couple of cameos for him for his graduation. That was fun to do. So anyway, cameo.com/weirdmedicine. And most importantly, simplyherbals.net. Yes. That is simplyherbals.net. And that's Dr. Scott's website. People are complaining that they can't get the nasal spray.
Oh, it's back up.
It's back up?
Yeah.
Okay. So if you were having trouble getting Dr. Scott's nasal spray, it is back up. All right, Lady Diagnosis, let's talk about, welcome back to the studio.
Thank you.
Let's talk about your malady. So what's been going on?
Well, it's just out of the blue. Every once in a while, I get a pain in my knuckles, in one knuckle.
Yeah.
Doesn't matter. It's been fingers and toes. All of a sudden, it'll start kind of burning a little, and I'll look at my knuckle, and it's blue. And it just spreads, and the pain gets sharper and hot.
Yeah.
And then the whatever vessel vein explodes, and my whole finger or toe turns purple.
Yeah. And then what happens?
It just hurts.
Yeah, and then what happens? It goes away on its own?
Well, it's blood in your finger, so it just wears away after like a week.
Yeah. And then, okay.
It doesn't really hurt after it explodes, though. It's the weirdest thing.
Yeah. And then how so, I mean, it sounds like scurvy, but how often does this happen, and then how much refractory time is there between the two
there's no
episodes?
rhyme or reason to when it happens. I mean, it can happen sometimes like every week, or sometimes it goes months and months.
Yeah.
So there's no rhyme
Is
or
it associated with trauma at all?
No.
See, the thing that pisses me off about this is apparently you told me about this and I just blew it off, and I apologize for that because you came in with the correct diagnosis. So how did you, before we get to what the diagnosis is, how did you find this? Because this is correct.
Wendy, my sister, I told her about it.
Damn it, that
she
pisses
said,
me off. I'm supposed to be
like
the hero
looking
in
it
this
up,
story.
and told me what I had. Thank God.
Well, good for Wendy. She's correct. But this is a thing called Achenbach Syndrome, and it's also known as paroxysmal finger hematoma. It's benign, self-limiting condition characterized by sudden, painful bruising and swelling of one or more fingers. It's believed to be related to minor vascular fragility, which means you need to be on vitamin C. You need to be taking vitamin C supplementation if you're not already.
Oh, okay.
Because that... So the reason I said scurvy is that's a vitamin C deficiency, right? And I've seen one case of this.
Oh, my God.
In the United States where, there are, these sort of hermit guys that live up in the hollers, and they will live on stuff that doesn't have vitamin C in it. And they'll get scurvy. And I've seen one case, and they'll have palpable purpura, which is basically, broken blood vessels under the skin. You can feel it, and it's all over the place.
Oh, okay.
And it's because vitamin C contributes to vascular integrity, right? So getting on vitamin C, you might be able to reduce these episodes.
So it's not hereditary? Because I believe I asked my uncle if he had ever had that happen, and he said yes.
Okay, well, and the other thing is, the first thing when you first told me about fingers, you always think of Raynaud's, and so that is on the differential. Let's look that up real quick. Let's see.
And I think I have Raynaud's too, because it turns, just kind of bluish in the winter. Yeah.
Okay, well, Raynaud's is a specific pattern. So I've diagnosed several of those in friends of mine. I believe, I can't remember if I diagnosed Mel B's or not, but I have another friend that I diagnosed. And what you do is you put your hand in ice water and you leave it in there as long as you can stand it. And what happens is the blood vessels constrict. So when you take it out of the water, your hands will be white because now they're deficient in blood supply. Then, as they continue to be deficient in blood supply, it will turn blue, indicating cyanosis, right? And then, as the blood vessels re-expand, then the hand will turn red as the blood flows back in again. So it's white, blue, and red. So it's very patriotic. And
way to go, lady.
That's right. There are other countries in this world that have. I think France's flag is also blue, white, and red. So, but that is distinct from this. This is different. So let's look at the genetics. Okay, with the exact causes unknown, research suggests genes related to acute phase reactive proteins. Well, don't worry about that. Okay. And the coagulation/complement cascade. Interesting. The complement cascade has to do with immunology. Might be linked to the condition, specifically the F3 gene. Or, we could do genetic testing on you if you really wanted to. We have a geneticist at our cancer center that could
that would be
do this.
intriguing.
The observation of Achenbach syndrome in multiple family members supports the idea of genetic predisposition. Now, you have a unique reason why you wouldn't necessarily know that, and we've talked about it on the show, right?
What's that?
Why you wouldn't know about your family genetics.
Oh, well, I did find them.
Yeah.
And I did start talking to my uncle, and I
asked him
about
you were
that.
adopted,
Yes,
and you found
I'm
your
adopted,
family
yes.
through 23andMe or one of those.
Yes.
Yeah. Okay. Yeah. And so you talked to him, and he said that did happen to him?
Yeah.
Wow. Isn't
I
that
know.
interesting?
And no one else in the whole world that I've ever talked to has had that happen. And so it's not. Have you all ever heard of that?
Yeah. Wow.
Achenbach's?
Yeah, I don't think so.
Well, there is.
If I have, it's been a long time.
Yeah, there is a song about it, though.
Oh, yeah, I remember that.
Let's hear about it.
Yeah. I remember that song. You ready?
Yeah, I believe so.
All right, let me get you some.
Test. There you go, test. The only two things in life that make it worth living are guitars that tune good and firm feeling women. Well, I don't need my name in the marquee lights. I've got swollen purple fingers and they're hurting me all night. Maybe it's time we got back to the Dr. Steve show tonight. Let's go to Achenbach, Texas.
No, Achenbach Syndrome.
And the boys. You threw me off.
You dumbass.
You threw me off. These purple fingers and toes, I've got a feeling like I can't control my pain. Between Dr. Steve's pain songs and Dr. Scott's Trey songs and G-Backs, blue eyes crying in the rain. Out in Achenbach, Texas.
No,
Diane
Achenbach
ain't
Syndrome.
feeling no pain.
Shit.
There you go. Well, hell, that was...
I know, you're looking at the words, and it's hard to not say the
Say it,
words.
yes. That was my
He's
dead.
obedient.
That was my dead level best.
The
Though.
Achenbach Syndrome. Anyway.
Hey, I wasn't bad though for
I
making
love
it up.
it.
No,
I
I wasn't mad. We just made it up on the fly, so. Stupid. All right.
You can tell this show has gotten much better
This
over
is
the
class.
last.
So yeah,
18
Lady
years.
Diagnosis and her Achenbach Syndrome. So try the vitamin C and see if it makes any difference.
Okay.
All right.